Hello, I'm Dr. Jeff Colyer, and I'm very honored to be the Lieutenant Governor of Kansas. I wanted to take this opportunity to explain some of the changes to Medicaid and how it affects Kansans as a consumer. First, let me start with why we need to change the current Medicaid system. As a doctor, I want to make sure that we get the best results for our patients. Governor Brownback and I insist on better quality of care for all Kansans. Unfortunately, the federal government has proposed a cut of at least $720 million in Medicaid for Kansas. And during the last 10 years, Kansas has seen a double-digit growth in both people using Medicaid and the cost of care for every person. Unfortunately, this already is starting to impact other state programs, such as KPERS, K-12 education, and public safety. Governor Brownback asked me last January to find out how could we make Medicaid work better in Kansas? How do we get better results? And so, with a measured 2-year-long process, we're aiming to improve our program for each and every Kansan. With members of the Cabinet, including Dr. Bob Mosier of the Kansas Department of Health and Environment and Sean Sullivan of the Department of Aging, we used 3 basic principles to develop KanCare. The first of those, and what is most important, is to improve the quality of care, to improve real results for real people. The second was to not kick thousands of people off Medicaid. And thirdly, not to cut current provider rates. That doesn't provide better results. We held public meetings across the state, countless meetings on the web with numerous individuals and groups. We wanted to hear from Kansans whose lives are affected by Medicaid services each and every day. And after listening to thousands of Kansans, legislators, advocates, and others, we have worked with them to design a program known as KanCare. KanCare is aimed at a better coordination of your social, behavioral, and physical health. We want to look at the whole person, help the whole person. By better coordinating your care and making sure you stay out of the hospital and helping you manage chronic conditions, we can bend the cost curve of Medicaid down. In other words, we can do better by making people better, better health results. Those with the most complex problems need better assistance. We need better assistance that looks at the whole person. Right now, we have a disjointed system that is one size fits all, and it doesn't give you choices that make sense for your personal needs. It doesn't coordinate care for those who need it the most, who have the most complex problems. KanCare will give all Kansans choices that will make the most sense for their own specific individual needs. Those with disabilities who have a care coordinator can keep their coordinator if they so desire. In short, we can get better care and save money by investing in preventive maintenance, in preventive care, by investing in long-term needs and making sure that we keep people out of medical institutions when they don't need to be there. To ensure that Kansans get preventive and long-term care they need, we're holding back $500 million in incentives unless we actually meet 15 measurable results that affect real people, like providing assistance to those with mental illness, providing preventive care, and making sure we have real physical results. A company does not make a profit unless they provide better health care for Kansans. That is how we do this. Most states have chosen to cut people from Medicaid or to cut rates so much that it's hard to find a doctor. Kansas has a better way, and it's one that we can work with you as a patient, as a Kansan, to get the best results for you and to give you choices so that you can determine what is in your best interest. Unlike most states, we're taking nearly 2 years to implement these Medicaid reforms to make this transition. In the fall of 2012, Kansas Medicaid consumers will be enrolled in one of the 3 KanCare plans. You will then have an open enrollment period where you can choose a plan that best suits your needs. Thank you for taking time to learn a little bit more about KanCare. And if you have questions or concern, please email us or contact your Medicaid provider. Thank you very much.